Hi, welcome to our another edition of our Community Cares Corner. And we have with us today Jenny McCoy, who is a family nurse practitioner from Cove Family Practice. And we're going to talk a little bit about being heart healthy today. Welcome, Jenny.
Thank you. Thank you for having me.
Okay, just a few questions for you. The first one is, what does it really mean to be heart healthy?
Essentially, heart healthy is a lifestyle that aims at the prevention of heart disease. So simply put, it's the things that you and I can do on a daily basis to prevent heart disease or to keep our heart healthy. There's one sort of component of this that I think that's important for everybody to kind of understand, and that is a lot of what we do to prevent heart disease is preventing plaque buildup within the vessels and arteries within our body, something that's called atherosclerosis. So a normal vessel, if you think about a hose where water runs freely from one end to another, with time and damage to our vessels, that, sort of free flowing of blood from one part of our body to another becomes narrowing till eventually it can become impede and block blood flow and oxygen to vital parts of our body. And so when that happens and blood is blocked to our heart, it causes a heart attack. And when that happens and blood is blocked to our brain, it can cause a stroke. So a lot of what we talk about in heart disease prevention and keeping our heart healthy are things that we can do on a daily basis to prevent that plaque from building up and causing problems.
Okay. All right. And why is it so important that we keep in mind being heart healthy, not just as adults, but for our children as well?
Well, heart disease is a big deal. It is the leading cause of death among all men and women in our country. 1 out of every 4 deaths is linked to heart disease. So that's huge. And to kind of put that in perspective, 1 person dies about every 36 seconds as a result of heart disease. So it's huge. And what we do know, the good news, I guess, is that the American Heart Association tells us that about 80% of these heart attacks and stroke events can be prevented by lifestyle changes. An interesting piece is that what we have found is that kids as early as age 10 to 14 are starting to show some of these earliest signs of heart disease. So some of that early plaque buildup that I talked about earlier, it starts at an early age. So starting at toddlers and preschools and developing lifestyles that will transcend is really important to prevent problems 30, 40, 50, 60, 70 years and beyond down the road.
Okay, great. Is being heart healthy difficult or expensive?
Well, I think the short answer to that is no. And unfortunately, like so many other things in our life, things can be simple, but not necessarily easy, if that makes sense. I guess I'll start by hitting 3 top things that we can do that are simple things that we can do and not necessarily expensive. The first one is just not smoking. Smoking is the single leading contributor to atherosclerosis within our vessels. And there's research that suggests that secondhand smoke contributes just as well. So not smoking, definitely simple, but not necessarily easy. But we do know that stopping smoking, no matter where you're at in your life, can decrease your risk of heart disease. So I always feel like it's never too early to talk about smoking prevention and never too late to talk about quitting smoking. The second one is just leading a more active lifestyle. And I think it's important to understand that doesn't have to mean expensive gym equipment or gym memberships. It's just about getting up and moving your body. Kids ages 6 to 17 need about 60 minutes of vigorous physical activity a day. And kids younger than that, 3 to 5 preschool, just need an active lifestyle for growth and development and to sort of build a foundation for an active lifestyle. So that can be things like getting outside, playing in the playground, playing tag with other kids, having a dance party in your living room. It can be, playing in the snow. It doesn't have to be difficult. Swimming, anything that gets your body moving. And as parents, I think it's important to set a good example for that. And again, it doesn't have to be up at 5 a.m. on the treadmill, but just showing your kids that it's important to get up and move your bodies. And then the last thing, again, that's simple, but not necessarily easy, is just eating a more healthier, having a more healthier diet. Simplest terms, that's just more fruits and vegetables, that's lean proteins, whole grains, and limiting things like saturated, transsaturated fats, and making things like fatty, fried, and sweets more of a treat rather than an everyday occurrence. Again, I'm a big proponent that small changes add up. And so find a place where you can start for your family. Sugary drinks are a big one, juices and sodas and teas and all that stuff adds up to lots of calories and extra pounds through the years. So sticking with water and milk and just involving your kids in making dinner and making choices and introducing them and reintroducing them to things like more fruits and vegetables is important as well.
Okay, great. What are there any things that you want to make sure we know before we end our conversation? Anything you really want to make sure that our families know?
I guess a couple little, maybe tips down the road is limit screen time. That's a big thing these days. I mean, setting boundaries upon that, more screen time leads to a more sedentary lifestyle. So limiting screen time is important. I think regular sleep cycles are important for kids. We know that evidence suggests that regular sleep habits, there's a correlation between that and healthy weight. I think it's important to get regular checkups for both you and your kids and talk to your primary care provider about things that you can do on a personal level. Make sure they're aware of your family history and your lifestyle habits. For adults, I think it's important to know your numbers. Those are things like your blood pressure, your good cholesterol, your bad cholesterol, your BMI, and then, again, talking to your provider about things that you can do to decrease your risk of heart disease. One other thing I'll just mention real quickly is I think that it's important to know what you're looking for if you are having trouble with your heart. And so being familiar with the signs and symptoms of a heart attack and a stroke, because that can be different with everybody. And I won't get into all the details with that, but brush up on that. The American Heart Association has a great resource at heart.org where they talk about all the signs and symptoms of a heart attack and stroke and what you should know and when you should seek help, as well as, all kinds of information regarding heart prevention and what you can do, healthy recipes, how to involve in kids in meals, and all kinds of good resources that would be valuable for any family.
Okay, great. One more question. If we have a family whose the parent might be concerned about their own heart health or even their children's heart health, what should they do?
They should talk to their primary care provider about it right away. Don't delay. And it's one of those things looks like all this, prevention is the key. So if there's any concern, bring it up to their provider, talk about it, and make sure that the issue gets addressed before there's, bigger problems down the road.
Okay, great. We really want to thank you again, Jenny McCoy, let me get this straight. Family practitioner from Cove Family Practice. We really want to thank you for giving us your time and all this valuable information. Thank you very, very much.
Yeah, thank you so much. It's a pleasure.